Welcome to Keeping It Real with Dr. Linda Chinn. This is the podcast where real life choices meet biblical truth without the fluff. Tune in every second and fourth Monday at 2 p.m. Eastern Standard Time as Dr. Chinn shares faith-filled, practical insights to navigate everyday challenges. Get ready for real talk, real life, and real answers.
Good afternoon. Welcome to another episode of Keeping It Real with Dr. Linda Chinn. I'm Audrey Bell Kearney, producer of the show. Had a few technical difficulties, but it is not going to happen today. Had to step out and step back in again. Listen, today's a great show. We got a returning guest. It's not often we have returning guests, so this must mean she made a real impression, not only on Dr. Chinn, but on all of you guys, because she has brought her back, and we're happy to have her. Today's topic is a hard pill to swallow. We have listen, I don't know about you all, but I have had to swallow some of those once upon a time in my life. So without further ado, I'm bringing to the stage Dr. Linda Chinn and Dr. Alexis Leak. All right, let's bring them up, and I'll be stepping backwards. Good afternoon, ladies.
Good afternoon, ladies. How's everybody?
Good. Welcome back, Dr. Alexis. How are you?
She said, welcome back, Dr. Leak. How are you doing today?
I'm great. How are you all?
Wonderful.
Thank you for having me.
Great.
Absolutely. I knew we would. And Audrey, we thank you so much for that energetic introduction. And as always, we're going to ask Audrey at the end what she thinks and what she got out of this podcast. So thank you, Audrey. See you in a few minutes, sister. God bless you.
Thank you.
Dr. Leak. Listen, I'm so grateful. Listen, I'm going to tell people a little bit about you again. You've been here before, and I'm so grateful for your yes again. But Dr. Alexis Leak she's a dedicated pharmacist, and she's got her Doctor of Pharmacy degree from South University School of Pharmacy, where she was a 2-time Dean's List honoree, and she graduated with high honors and a high GPA of 3.5. She also holds a bachelor's degree, you all, in chemistry from Valdosta State. She's originally from New York, raised here in Georgia, and she and I have connections over the years. But one of the things that I love about Dr. Leak is that what you see is what you get. That smile of hers is real. Every time you see her, that's who she is. And another thing that I know about her is that she really, really cares for the patients, and she's going out of her way financially, and she gives good advice to people. And if you know what times we are in now, not everybody is documented, and some people who are not documented need medications, and she's got the compassion of Jesus Christ, and she does it discretionally, with discretion. So Dr. Leak, again, welcome back to the show. Thank you so much.
Thank you for having me back. I am so grateful to be back.
Yeah. So this hard pill to swallow, this has been bothering me, right? These things have been bothering me. And I wanted you to come on and help us learn and talk about side effects of medications.
Yeah.
I've been on some medications. I'm just going to give you a brief example, and we're going to let you come on. And I've got some questions, but one of the medications that I had to take for hypertension was amlodipine. And I can't remember the name of another one she put me on, and I guess I should have thought about it. But these medications, the amlodipine is one that caused my feet to swell.
Yeah.
And I thought it was sugar. I backed off the sugar, and my feet still swell. And one point, my foot swole up so badly that I couldn't get my shoe off.
Oh, no.
I couldn't get it off. I had to lay down and wait for it to go down. So, talk to us a little bit generally about the medications and their side effects before I get into any of the questions. What do you want to start out saying?
It's kind of hard to talk about side effects. I mean, they are there with every drug. It has a side effect. That's just the case. But what happened to you might not also happen to others. Everybody's body is completely different. So trying to explain that, yes, this could happen, and this actually will happen are like two different things. So having to explain this could potentially happen is the best way I could get out side effects, because it's a potential. It's like something to be aware of. Because some people, like you said, you thought the swelling was your sugar, but had your doctor told you or your pharmacist told you that it's a potential your foot could swell, you probably would have went to the doctor sooner. So
I like that. I like that. What can be a side effect and what will be a side effect. And when I called my doctor, she's so good. She called me late that night and I told her what was going on. And she said, well, I don't know that that's a side effect. And I said, no, I got it up right now. It is a side effect. She's a good doctor, right? But all doctors don't know all side effects of all medications. I mean, that's just being honest. And so, what are the most common side effects patients experience with over-the-counter medications based on your experience?
See, I feel like that's a loaded question because, again, what happens to you will potentially happen to somebody else. What works for someone works for someone. It might not work for you. You might receive the side effects of it. Like someone might be using nasal spray after a nasal spray. After 3 days, you're really supposed to stop taking it because it could cause a rebound effect of congestion. And people normally don't know that. But if you're doing it daily and you've never experienced that, I can't tell you, hey, stop now. Like, it works for you. So it's kind of tough to say over-the-counter meds, this is what you need to look out for with this med. This is what you need to look out for with this med. It's really tough. I don't like to tell people no, especially when I don't know their history. I just know what's safer to go with if I don't know your history.
Okay.
But I can't tell you that's going to be a side effect for you. Does that make sense?
Okay. It does. It makes perfect sense. So how do you, as a pharmacist, and people come back and say, you know what, this or that happened and other thing, how do you, as a pharmacist, how are you able to explain or help them understand the difference between a side effect or an allergic reaction?
So now this one I definitely deal with on a daily. A lot of patients feel like they're allergic to medicine because they experience a side effect. And that's not the case. Like, for example, everyday antibiotic is amoxicillin. Everybody feels like amoxicillin makes my stomach hurt. I'm allergic to it. And it's like, no, actually, a side effect of amoxicillin is your stomach hurting the higher the dose. That's why they ask you to eat before you take it so your stomach doesn't hurt as much. But unfortunately, that's a side effect that's very, very common with amoxicillin. So people will try to tell me I'm allergic to it because my stomach hurts. And it's like, you're not allergic. You're just having a side effect of it. Allergic is like, I'm breaking out in hives. I can't breathe. I really need to go to the doctor and get this off. That's an allergic reaction. That's things that we take more seriously and we put in your chart to make sure you never have again, because allergic reactions can definitely get worse over time. So
you have charts for patients? The pharmacists have charts for patients?
Yeah, you have a whole profile. I can see what you were taking over the past, well, at least my place of work keeps it for at least 3 years. So I can see what you were taking for the past 3 years to know, oh, you did do this before. You never reported to me that it was a problem. So that's why they assumed and gave it to you again. Like, if you don't tell somebody, it's never going to be charted anywhere that you ever said anything about
So
it.
are your charts, your patient charts, are they linked to the physician's charts or is yours separate?
It's separate. Yeah.
I never knew my pharmacist had a chart. I'm just
It's
now
not
finding this out.
necessarily a chart where I'm like, oh, I got your labs. I just have all your medications. I can
That's
see
good.
all your medications. Yeah.
That's good to know. So I hope you all are listening, realize that your pharmacist has a list of the medications you take. I did not know that. So thank you.
Granted,
Thank you.
I don't know. Prescriptions expire after a year. I'm still here. Yeah. Prescriptions expire after a year. So even though I can see it, I can't do anything with it. I could just tell you, you did do this before.
Excellent. That's still good information for us. That's good. So can supplements, vitamins cause problems when taken alongside medications?
I definitely think so. Some people feel like or see things online like, oh, vitamin B12 can give you energy. Well, if you never went to your doctor and got your labs, vitamin B12 could also be really bad for you. Your body could be making too much vitamin B12. So you're just taking vitamins because you see that they could potentially be good for you, but you don't really know if it's good for you. And then also, some people take vitamins and don't report it to the doctor. Well, some vitamins interact with medications. So if you don't say, I'm taking this on the regular, well, you could be decreasing the medicine that you're taking, and now you're just taking it for kind of no reason. You're just taking a placebo effect.
Now, see, that's good. Again, that's good. So we can be in the midst of company, in the midst of people who we know are very intelligent people, people we admire, people we kind of like what they say. We know they're well read, who will say, yeah, every day, I make sure I take calcium.
Mm-hmm.
And so now somebody goes and takes calcium. Well, I don't do that, but I found out when I did my last labs that I had too much calcium. Right.
Mm-hmm.
So it's not smart to just go take a vitamin, people,
Yeah.
because someone says it's good. All black ladies, all black women need fish oil. And you understand what I'm saying?
Yeah, exactly.
Talk to
Like a
me.
multivitamin, okay. Like it's normally not harmful for you because they don't give you as much. It's just one more small pill that you take a day to keep your levels evened out. But I also encourage people to also go get your labs done. Like
Go get your
you'll
labs
never
done.
know unless you get labs done telling you how your levels are even are.
Awesome.
Yeah.
Awesome. Listen, thank you, Renee and Shamika, Richard and Darlene for joining us today. Throw in a question if you've got a question. And so again, we appreciate you joining us. So Dr. Lee, between the pharmacist and the doctor, who would you say gets the most questions about medicine side effects?
I'm gonna assume the doctor because I don't really get questions about side effects. Um, And I don't discredit doctors. They definitely know what drugs you're supposed to take to treat what things because that comes with being a doctor. But
Mm-hmm.
I mean, a pharmacist, I really went to school strictly for drugs.
Mm-hmm.
So I might know a little bit more about what the drugs actually do to your body.
Mm-hmm.
Granted, I can't diagnose you. I
Mm-hmm.
just know what the doctor said here, it makes sense that you're taking this, or what the doctor said here, it makes zero sense why he gave you that, and take it or don't take it, and things like that. So I think I would kind of know. And then side effects, it's kind of tough too, because I'm a retail pharmacist. I know more about drugs that people get outpatient. So once you leave the hospital, um, clinical pharmacists, they're the ones in the hospital. So infusions and things like that, IV compatibility. Yeah,
Mm-hmm.
I learned that for my test and I never had to look at it again. So if you
Mm-hmm.
ask me, I'm probably going to tell you, give me a minute so I can look at it again because I
Mm-hmm.
don't remember. But if you ask me an outpatient question, I will probably know the answer to it. It's
Awesome. That's another thing I didn't know. Welcome. Thanks for joining us. Let's Live Christian Family and Pastor Michelle Johnson. Thank you. Listen, I didn't know that there was the clinical pharmacist and the retail pharmacist. See, there's a lot we don't know.
Yeah, there's a lot more pharmacists than that. There are people like you have a cardiologist, there's a
Yeah.
cardiologist pharmacist. There's people who just strictly specialize in things because I mean, special cases happen. Infectious disease pharmacists happen too, like where people study strictly new things like COVID and stuff like that. So it's really all types of pharmacists. So when a pharmacist says, "Oh, I don't know that," it's like it might just not be in their field. But every pharmacist I know is very capable of looking up that information and knowing right off the bat, like what something means because
Interesting. Very, very interesting. So I remember having a foot surgery years ago and talking to the doctor about a medication that was the anesthesia. And I guess I wasn't given enough because I started feeling that drill, right? And that drill and stuff. And so the doctor doesn't necessarily administer the medications. It's the pharmacist,
So
clinical
with
pharmacist.
surgery, no, that's an anesthesiologist.
Okay.
They have a whole special zone, they're their own doctor as well. Like when you go under surgery and things like that, they're monitoring your levels. They know how much you need and how much you don't. Well, at least they're supposed to know. I don't know how you felt at that time. That's a whole different domain. A pharmacist, however, might be the one giving them the drug, but they're the one that understands the monitoring parameters and things like that. So I know what I might be like telling them to give you, but I don't know at all how to handle you, manage you, take care of you. I just know what I'm giving you. Like, I know that's supposed to put you to sleep, and I know what's supposed to happen, but I don't know exactly how.
So do pharmacists, in your case, or retail pharmacists, do you have the legal obligation or the right to warn of the volatility of a side effect of multiple medications?
So we are legally obligated to counsel patients and say that things are bad or good. So like for instance, oxycodone or hydrocodone, acetaminophen, people get that for pain after surgeries all the time. I have to legally counsel you to tell you that this is potentially addictive. This could potentially cause an overdose if you take too much, like telling you the side effects of what could happen. I have to do that. And then if I don't, I could get in trouble legally as well for not saying that. You could sue me, it could be a whole plethora of things. So I definitely have to counsel. But some drugs that aren't harming, that have been proved not to be harming, I don't have to necessarily counsel. So if I say or ask you, do you have any questions? And you tell me no, I don't have to tell you anything else. There's nothing to say.
Okay. Oh, interesting. So we have a question from Darlene. Welcome, Darlene, Dorothy, Ursula, and welcome. And so Darlene has a question. I received a pain prescription from a doctor with no refills. I called for a refill, but was denied, given whatever that is instead. You can see what that is.
Yeah.
I then asked my doctor for the pain prescription, and he said he couldn't give it to me because the other doctor already prescribed it. How can the other doctor be allowed to give it to me? Does the original doc have to discontinue with the pharmacy? Do you have the capacity to answer that question? Or is that something she needs to call the doctor about?
I don't know. So that's also another thing. Patients always think they need to call their doctor for every small thing. You do not need to call your doctor to ask them for refills. 9 times out of 10, they probably already sent that in. But Miss Darlene, for pain medicine, probably a narcotic. Legally, narcotics cannot have refills at all. So when a doctor sends it in, it's always going to say 0 refills. You need to legally go back to your doctor, see them again, explain your pain for them to say, yes, you need another refill. 9 times out of 10, you calling in saying, I'm experiencing pain. I don't want to call you an addict, but it comes across as an addict. And then doctors experience addicts a lot. So, and they call a lot. That's normally what they do. If they can't get in touch with you by getting an appointment, they're going to keep calling until they get what they want. So when people keep calling, it's like, no, we'll give you an alternative. Methylprednisolone is a steroid that helps anti-inflammatories. So it's supposed to help with pain also. So that's why he gave you that, because it's not a narcotic. It will be safer. You wouldn't be addicted to the feeling of the pain helping you, because it's really just numbing the pain. It's not particularly fixing the problem of the pain. So a lot of doctors don't like to keep continuing patients on that, because that's how you get addicted and that's how problems start. Or if the pain is that bad, you go to a pain managed clinic where there's a doctor that physically gives you prescriptions every month to make sure your pain is treated.
Thank you. Great question. Great question, Darlene. Thank you so much. We're grateful. So drug seekers. So I have another question for you. So are there any medications you find patients are consistently surprised by in terms of their side effects?
I will say in the Black community, one that surprises people a lot is I'm trying to say it in a way people could understand, is a hypertension medicine like lisinopril. I feel like people know like lisinopril. A big one, it's very beneficial for the African American community. It helps blood pressure, and it can also help protect your kidneys. So it's really, really good. But also the biggest side effect in lisinopril in the African American community is angioedema. And angioedema is basically like the swelling of your throat, your mouth, things like that. And when you experience that, it's a no-go. Like, you need to stop taking it immediately because it could cause too much damage and too much harm, and they'll never take it again. That's an allergic reaction, and that's the one that we stop each time. And if you can't take lisinopril, you can't take something else called like losartan. That's another common one people take.
Yeah, that's
They
the one.
basically work the same in the same class. So if you're allergic to one, we know 9 times out of 10 you're allergic to another. But risk versus benefit, we also just know in the African American community, that's the most beneficial. So that's the one they're always going to put you on first.
Okay, I have a question about, and I know I know you know this. Let me grab it. I had it up before. So, what are black box warnings, and why are they called that?
Okay, so black box warnings is the most serious risk that could happen in a medicine that you want to be alerted about, like immediately when it happens to you. For instance, I'm trying to think of a common one that people don't know about, but it's not a common drug. There's not many drugs that have black box warnings. Now, why is it called black box warning? I don't know, but it sounds scary. So it makes you want to pay attention if you ask me. Like, when I hear black box warning, I want to pay attention to it. So I think a common one that people sometimes get is Montelukast or Singular. It can help with allergies. It can help with asthma. Doctors give it to you. However, the black box warning for it is suicidal thoughts. So that means if you're already experiencing sadness and depression and not wanting to be on this earth, it's going to increase it times 10, and bad things could happen. And so, especially in the African American community, they don't tell their doctor that they're sad or going through things. So if you don't tell the doctor that you've already been feeling sadness and not wanting to be here, and he gives you that, it increases it. And then now we're explaining things that had a bad case that we didn't know because we don't talk about it.
Yes, yes. Well, welcome, Meredith, Olive, Margaret, Peg. Welcome, Erika. We're glad you joined us today. So I have seen a little black box warning on my mom's medications years ago. Some medications that they gave her for pain when she was suffering from cancer. And it was a narcotic, if you will. And I lost the prescription, and the doctor thought I was lying. And so it's hard. So let me tell you, if you're taking those pain medications for cancer or something, you do want to keep tight those prescriptions, right?
Yeah, especially the pain meds, because they're addicting. And the black box warning for those is respiratory depression. And really what that means is just shallow breathing, like you're not getting enough oxygen. And that's normally when people are saying help, they're not breathing because they're overdosing, and then they need Narcan to reverse it.
So I have been looking at a lot of different medications. This is where all of this podcast topic stemmed from, a hard pill to swallow. As I've been watching television, I had a chance to watch television a little bit lately, and they have these commercials about medications, and they tell you about the medications, and then they tell you about the side effects. I'm laughing, but it is not funny. It is scary as the dickens, where so I shouldn't name the medication, should I? Should I name the medications?
You can.
Okay, so like I saw some of the effects of Ingrezza, right? That's taken for those movements where people have those uncontrollable movements, right? And it said some of the side effects was Parkinson's disease, muscle stiffness, and slow speech. And things like that. And I'm saying even medications where I saw people take for depression can cause suicidal thoughts. And my concern, I became concerned about it because I thought, are people reading the mice print, I call it, or the long sheets that come with their medication? I have a feeling, Dr. Lee, that many of us are not reading that information. What's your take on that?
So legally, they have to tell you all this stuff. So you go through clinical trials, you figure out everything that could potentially happen to a person. So they legally have to tell you that this could happen. Now, I also feel like as a doctor, risk versus benefit.
Mm-hmm.
Because again, side effects are potentials.
Mm-hmm.
It's not the end all be all. What happens to you might not happen to someone else.
Mm-hmm.
So saying you take it and you're like, I'm fine. Everything worked out great. This medicine has been working for me for years. And you recommend it to your friend, they get Parkinson's. They get every single thing that happened to them. And you're like, what? I swear by it. That's because your body is different from theirs. I can never say, I mean, I can say some drugs, ooh, they got so many side effects that that's kind of bad. I would try to stay away from that. But then at the same time, some people don't have a choice. It's like you've tried everything else. You have to try this to make it work for you. So it's like, all those side effects, they sound so horrible, but in your case, it really might work out and you really might not experience any of that at all.
I've been talking to someone who's had that experience with a medication where nothing worked for her, and she ended up having to take holistic things that worked for her. So I thank you for keep pointing that out. Ursula McCleary has a question. Can you sign up or be approved by a pain management clinic prior to a major surgery that has history of bad pain afterwards?
No, because a lot of people who go or sign up for, you don't even sign up for a pain clinic. You are normally referred to by a doctor. Like, let's say you've been going to, I don't know, a neuro doctor that works on your brain, and you getting pain meds a lot from him. He might just say, like, I can't keep managing this. And so he'll refer you to a pain clinic. A lot of times surgery, doctors give you pain meds because surgery causes pain. Like, you are harming your body. They're piercing into your skin, your organs, like it hurts. So they're giving you enough to last you what they think the pain should last. Like, I think your pain should last a week, so I'm giving you a 7-day supply of the pain med. But also, doctors don't just give you a high narcotic of pain without giving you something else. Like, they will give you a narcotic that will last 5 days, but they're also going to give you ibuprofen and prescribe Tylenol so you could switch out with that. So if your pain is at a 10, you take that narcotic. But if your pain is at a 5, you don't need to take that narcotic. You take that ibuprofen and you just deal with the pain. You should be weaning off the pain. The pain should not last long. And if it does last long, that's when things move towards pain management clinics. The drug won't get you addicted if you're not taking it for a long time.
I love that. I love it. So when we read about the side effects of medication, does most of that information come from the doctor or from the pharmacist as having been reported to you by patients?
So, she said pain management after my husband's surgery was horrific, and getting enough meds was always a struggle. Also, seeing a lot of doctors does not help getting pain prescriptions per se. I do hate that because it's like they refer you to different people, and different people will try to give you different pain meds to help you. But I'll say, in a pharmacist standpoint, filling narcotics and seeing you have different doctors giving you prescriptions is a red flag in our world. And it's like, hold up. And then, for instance, if your pharmacy doesn't have it, you're going to travel around to different pharmacies. Another red flag. You were just at Walmart. Why are you at Publix? We didn't know that Publix didn't have your pain prescription. We're just going off of what we see because these things are monitored and people don't understand that. We can see how much you're getting and how often you get it. If you're getting it early, if you're getting it later, we can see all that. So it does play a part, unfortunately, too. And too many red flags make people say no. And we have the right to say no.
Wow.
Yeah.
Is it shared? Are the records, are the medication, the history, is it shared amongst different pharmacies? Like
there is a website for doctors strictly. There's no one that could really get on that's not a doctor. You do have to have the credentials to do it.
Mm-hmm.
That shows narcotics, and it's across America. So I could see if you went to Wyoming and got a pain prescription last week because you hit your hip, and then you all the way back in Georgia trying to tell me, no, that didn't happen. Like, I could see that. So it's like, well, if you didn't do it, then somebody did, and now we have to investigate, and now you really can't get it.
Wow.
So it's like, but it is monitored, especially for, I'll just say, for narcotics specifically and controlled substances. That's monitored.
Awesome. I'm loving it. You're really educating us today, and I'm grateful. And still, I encourage, and Dr. Leak encourage you, when you get that paper with your medication, read it. Read it. Don't just tear it up and throw it in the trash. And it's important. You need to know the possible side effects. And I say that because we don't often read it, we could possibly experience something and think, it came from outer space somewhere, and maybe it is a side effect of the medication. So if you read it so that you'll be informed. But this is something that I don't expect you to really comment on, Dr. Leak, but I did want to share with our audience today. So about 2-3 years ago, some friends and I, we went to Nashville, and we went to this boot store, and we bought these cowboy boots and leather boots and so forth. Well, I had this pair, but it was in the summertime. So I had this pair that I didn't wear till, the appropriate season. And when I opened the box, there was a tag that said, these boots are made or consist of material that have possibly caused cancer. It's been reported in the state of California. I looked at luggage. When you buy that plastic luggage, everybody, I'm just telling you, when you buy luggage, whether it's at Marshall's, Walmart, whatever it is, people buy the plastic luggage because we think it's more durable, as they throw it on and off on the belt. But you look at those tags. I looked at some leather chairs that are made of bi-cast leather, right? California reported some cancer causing, properties in it. And so, I'm just saying, be aware, read the tags, read the paperwork, read. And I see Darlene has another question. We'll get back to that after you answer Darlene's questions, Dr. Leak.
Okay. Doctors prescribe a lot of medications. Do they get some kind of kickback for prescription pickups? I'm going to say yes and no, because drug reps do get money from patients getting prescriptions, honestly. So a lot of drugs in the beginning, when they first hit the market, they do go to doctors' offices because doctors are allowed to hire drug reps, and that's how they're able to get samples and things like that. So they'll try to put patients on that prescription to essentially get money from it, or not even. Sometimes it helps in like case studies for us to understand side effects. They'll put patients on. That's why they'll give you samples, and they'll monitor you closely. Like, oh yeah, you need to come get labs. I'm going to put you on this that you've never heard of. But then you go to your local pharmacy and it's like $1,000 because it's probably a little experimental or pretty new that insurance is saying, absolutely not. I will not cover that. There's something cheaper that she could get. So yes and no. I mean, some doctors don't go for it and some doctors do. It just depends.
Okay, so I want to make sure we're answering her question and we're seeing it, because she says doctors prescribe the medication a lot. Do they get the kickback? So is it the sales rep or the doctor or the pharmacist?
It's both. The pharmacist doesn't get anything. Well, depending on what pharmacy. There's independent pharmacies. People own their own pharmacies. They have more range to do what they, I won't say what they want, but they have more range to do things than a corporate pharmacy. Like, I'm in a corporate one, so I go by their rules. I can't just order off any website and get any drug. They will restrict me from doing so. So it's like a doctor's office. A lot of times they own their own practices. They have, I won't say free range, but I mean, within a certain window legally, you can do things to boost you.
Interesting. So what do you think about those tags that I was telling you about? Do you have any thoughts on that?
I mean, again, legally, you have to say the risk. Like, you have to say the risk for everything now, because people deserve to know. Now, do people read it? 9 times out of 10, probably not. But I also don't think it's something you should freak out over each and every single time, because some people
Right.
will read things and think it's going to happen to them
Mm-hmm.
all the time. And it's like, well, that's not the case. I've seen several cases where people have done this for years or get the plastic luggage and they're fine. But I mean, it's
Mm-hmm.
a risk. So
Mm-hmm.
everything has.
It's just good to be informed. It's good to be informed. Read, 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 read. Dr. Leek, do you think side effects are underreported by patients?
I do think so, because some things will get written off. Like it's no big deal, and then some things are a big deal and they don't realize it's a big deal.
Mm-hmm.
Um, like for instance, I'll say bleeding, well, or stomach hurting. So ibuprofen, that's something over the counter all the time. People will take it for pain, like, oh, I have back pain, I'll take a couple, and they'll do it like every 2 hours. Well, that's obsessive, and they don't know that it could cause stomach ulcers. Like, keep taking it way too much, that's not good for you. So it's like that's a side effect that's like bad, but that's also a side effect that happens when you take it too much too.
Mm-hmm.
It's not good because it's over the counter and you could just buy it. It's good because it works when you need it, not all the time.
Got it. Got it. So, are there any specific drug combinations that you're especially cautious about due to their synergistic side effects?
That's a tough question because there's so many drugs. Like I can't say there's a common drug combination that it's like that is scary that your doctor did this to you, because 9 times out of 10 there's a reason the doctor did that specific combination. And it's like some drugs work on one part of your body and you need another drug to help you work on the other part of your body. And it's like, even though this side effect, it would be terrible if it happened. Risk versus benefit. Like
Risk versus
sometimes it's
benefit.
like, we're going to do it and we're going to monitor you and hope that the outcome is good. And if it's not, then let's start again. And unfortunately, that's like the gamble you do have to play.
Risk versus benefit. We got to remember that. So, Michelle Johnson has a question. How do you feel about brand drugs versus name brand? Is there a big difference? If not, what makes them different?
See, this is the question I get all the time.
Really?
Yeah, because there really is no difference. The big difference is the name you're paying for. Exactly. Tylenol is the same exact thing as acetaminophen, but acetaminophen just sounds different. It sounds good in a doctor's office. It makes you think I'm getting luxury.
Wow.
So it's like, oh, okay. But then if I tell you, yeah, actually, your insurance isn't going to cover that because he gave you Tylenol. And people get so shocked. What? That's all he gave you is just Tylenol. Like, it's over the counter. It's $5. There is no difference. Now, certain things insurance will cover. So it's like, oh, okay, actually, I am going to get that here and I'm not going to get it back there. Like that Clofenac gel. That Clofenac gel is just over the counter Voltaren gel. Same percent, same everything. People will be so shocked every time. And I'm like, you can get that over the counter. It's actually easier because I'm going to charge you more. Even though I don't tax you, I'm going to charge you more. But over the counter, you could get it. And you could also use your health spendings card and it's still cheaper. So it's like, there is no big difference besides a name you're paying for. Now, I also say preference. I like Allegra, but fexofenadine is the generic name. I don't want to take that one. That's just me. But preference, but no difference.
Wow. We're almost out of time. I cannot believe it. I'm so grateful for everyone who joined us today with their questions. And I also want you to pat yourself on the back, applaud yourself for joining in and asking the questions that a lot of people really want to know. Please. Come on, Audrey, because I know you got some stuff. Thank you all. I'm grateful.
This has been so informative and educational. Thank you so much for just sharing like all of this great information with people. Because people have a lot of questions about prescriptions and medications. So one of my thoughts was I recently became a part of a company who they manufacture supplements. with adaptogens and nanotechnologies and things like this. So when it comes to people who are just deathly afraid, even though the doctor has prescribed the medication, they come to you and they say, listen, I really hate taking medication, because I'm sure you hear that a lot. Do they
Yeah.
ever ask you, what can I take that's not a medication, that's a supplement? And how do you handle that?
I mean, there are supplements that help, but I won't necessarily say that they will work as effectively as prescription drugs. Like, if you're pre-diabetic, I am all for supplements, changing diet, healthy in-style, things like that, because I mean, that can be changed. Certain things can be changed. Your blood pressure, you can get that regulated and you can get that under control without having to take medications, but that comes with lifestyle changes. You can't just think you could take a supplement and it'll be fine. Like, you have to also put in the work in your life to be okay to just take supplements. And if you don't want to put the work in your life, then I'm going to tell you every time, your best bet is to go to that doctor and get that prescription drug, because it's not working. And I hate it. And of course, we don't want to put drugs in your body. I never want to encourage people to put drugs in their body and alter their body, but sometimes it helps you live longer, and we want you to live long. So again, risk versus benefit. You want to change your life, or do you want to take this drug? Like, kind of like that. And some over-the-counter medicines, supplements, I recommend, and then some I'm like, there's just not any information. So you're taking this blindly. Basically, you're a part of a case study right now. They do it with the FDA, but they don't have to report everything. So you want me to know, is it good for you? I have no idea, because there's not enough information out there. And I know where to look to find good information. It's just not, and they don't have to report that if they don't want to.
Wow.
Yeah. One of my friends is pre-diabetic, and she said, I'm not taking anything. I'm about to change my diet. I'm about to change everything. That's what she did. She's doing really well. So I can't wait to see what her numbers are going to look like once she has gone back to the doctor.
All right, we got one more question. Do we have time to take it, Audrey?
You got it. You got 2 minutes.
Okay. What happens when your medication changes in appearance? From Meredith Furell, the size of the pill is smaller than it had been.
Hi, Nana. So basically, you just change manufacturers. There's different companies that make different drugs. Same exact drug. It's just they want theirs to look a certain way, feel a certain way. Some people are more comfortable taking smaller pills, so they'll purposely try to make it smaller, or they like the shape. That's just how their company is. That's their staple. They always do triangles, and another company always does circles, and they always make it green. It really is just the company. It's nothing wrong with the drug. It's the company making it.
Different manufacturer.
And so sometimes we tell patients that, because some patients will get like, oh, they gave me something completely different. I didn't get prescribed this. Or like some patients are like, oh, is this just the same thing? And I'm like, yeah, it is. And they're like, okay, cool.
Thank you. Thank you.
Dr. League, I got one last question for you. Is there a place for the regular everyday consumer to go to kind of, I know when they get the prescription, that has a lot of information there, and we throw it in the trash. Like Dr. Chinn said, it just goes right in the trash. Nobody pays any attention. But is there a place for them to go to find out about all of the different medications in one location, one central location that they may be taking?
Unfortunately, I'm going to say no. I literally had a class just on research, because you really do have to research a lot to get accurate information. So no. And unfortunately also, public doesn't have a lot of that. I won't say they don't have the access to get into that information as well. Like, you have to be a doctor. You have to have the credentials to see certain reports, see certain research products. So it's like, I won't say yes to that, but there's also places you could go to find it. You just have to find it. Yeah.
Awesome. Before Audrey takes us home, what improvements would you like to see in the pharmaceutical world, Dr. Leak? I want to give you the last word.
I would just say being more out in the community, being more formative with people, just about everything. Day-to-day lifestyle can really change you from having to even take medications, from us even having these types of issues. But also sometimes people have to take medications and they just refuse. And it's like, but the medication will save your life. So I'm an advocate for both. I just want a long lifestyle for everybody. And it can be healthy, but that also comes with putting in the work for it.
Put in the work, people.
Gotta put in the work.
Okay.
Listen, guys, we hope you enjoyed this episode. As always, a great guest with great information. We hope that she helped you answer some questions that you may have had. Now moving forward, you have a better way to make informed decisions about your own health. I do. Dr. Chinn said something about amlodipine that I did not know, and I take amlodipine. I'm like, what? Wait a minute. I'm one of those people who don't like doing Google research. But anyway, thank you so much, Dr. Leek, and thank you, Dr. Chinn, for always bringing us some amazing, amazing guests. Listen, if you enjoyed this episode, share it with 2 friends, not 1, but 2. It's free, doesn't cost you a thing, and subscribe to the show. Subscribe to the show. When you do those things, that help us move up in the algorithms, and that lets YouTube and Facebook and all these people know that, hey, this information was helpful to me, so we can be helpful to even more people. So do us a favor, subscribe. If you want to support Dr. Chinn and all the work that she's doing, go to LindaChinnMinistries.com to do that as well. She will appreciate that as well. So thank you all again for joining us. We'll be back in 2 weeks, same place, same time. Till next time, make it a great day.
Peace.
Bye,
Thank
guys.
you, Dr.
Bye,
Leek. I
everybody.
love you. Love you, Audrey.
Thank you. Love you too, Dr. Chinn.
Bye, guys.
You've been listening to Keeping It Real with Dr. Linda Chinn. If you enjoyed this episode, hit the like button and share it with a friend. Be sure to support the show by going to LindaChinnMinistries.com. Subscribe to the show so you never miss an episode, and tune in again in 2 weeks at 2 p.m. Eastern Standard Time. Until next time, keep the faith and keep it real.